Anyway, now we're in a situation where this healthcare legislation has been passed, and just from the perspective of a practicing physician, I've been out there for 10 years now. I don't come from the old school. I never made $1 zillion. I've got no 401k. I've got no college fund for my kids. And in the end, it's not about me, but it's about my ability to deliver the best possible care that I can deliver. And when you take away innovation, when you take away my ability to deliver healthcare in a way that I see fit in consultation with my patients, I have spent my entire life, my entire adult life, learning how to be a physician. And I can tell you that the phrase about healthcare being an art and not a science is extremely profound, and it's very true. There are things that I've learned from study, and there's a lot of things that I've learned just from personal experience, and I meld those things together, and I take each individual case as it comes, and I offer different treatment options for different patients, oftentimes for the same problem. The idea that a government bureaucrat is going to implement medical protocol in real time is utterly ridiculous. And that is exactly what just happened in this legislation. It says, it was on 148 and 149, but my wife's an attorney, and she says people think you're a moron if you go by page number, but I apologize, I can't remember the section. It states that the Secretary of Health and Human Services is going to be responsible for writing medical protocol, and any physician that doesn't follow that protocol is going to be ineligible to participate in the healthcare exchange. That is going to put me in a position eventually, and all physicians, in a position where you are going to have to knowingly do the wrong thing for your patient in order to comply with the law. And so we have a real problem here. Now, that's the bad news. Also, this has happened. For those of you who aren't aware, our healthcare system has been destroyed. It has happened, okay? We need to undo this thing, and it can be undone, and there's a silver lining here. Healthcare is on the forefront of everybody's mind, and there are solutions out there that have been proven to be effective, and hopefully we'll be able to get into talking about what some of those are today.
Okay. Dr. Davidson.
I'm Dr. Gene Davidson. I've been involved in looking at healthcare and healthcare delivery systems for a lot longer than Scott or Brian, and been involved with lobbying in Washington and lobbying at a state level, and in the organizations that have tried to promote healthcare and the quality of healthcare in this country. And it's, you know, it is unbelievably complex issue, and I think, not to belabor what Brian and Scott have said, but the question of access, the question of quality, the question of cost really are the keys, and we are not headed in the right direction. Hospital system, I'm on the board of Catholic Health East, which is the parent corporation of this institution of St. Joseph's that we're sitting in. And I will tell you that if most hospital systems in the United States, certainly those east of the Mississippi, are in significant financial trouble. The problem, interestingly, is not as much due to baby boomers, and all deference to many of us here who are. It's actually because our technology costs, the things we're able to do, have gotten incredibly expensive, and will continue to do that. There's an excellent article that shows that in the next 50 years, as our healthcare costs rise, that actually the real single largest component of that rise in true dollar costs will come from technology. We're very involved here with a project at Georgia Tech on genomics and individual cancer treatment and therapy, and that holds tremendous promise for our ability to diagnose and treat diseases that we have not done, that we don't have particularly good answers for. Unfortunately, the cost structure is enormous. So the challenge is, on the one hand, we have a fabulous opportunity. On the other hand, we have decisions being made on political bases, disregarding an awful lot of the real-time information. So how do we correct that, or how do we get that into the system so that what we do is cost effective, we do increase access, which has become a major issue, and we can control costs. I wouldn't say we're going to decrease costs ever, but at least they can come under some kind of a rational top. Probably 7 or 8 years ago, Pete Peterson, the former Commerce Secretary, who has been very successful, wrote a great book on the failure of both the Republicans and Democrats to address these issues. And as we've mentioned, the numbers are fungible, but we know that left to its own devices in another 10 years, Medicare will have accrued a deficit that makes our current national debt look puny. And that obviously just can't happen. So we've got a lot of reality to deal with, and it won't get solved with political decisions. It has to get solved with data-driven and basic sound reasoning and a system that pulls together and that everybody's headed in the same direction, which we really don't have at this point.
Thank you.
Can I say one thing? And just to make sure everybody's here, and I'm sorry, and just to echo what Gene said, this is not a political issue. This is not Republican. This is not Democrat. This is our health care. So I think if we come in here with these political ideologies, we need to set those aside, and we need to more focus on problem solving. So just to kind of reiterate, I agree this is an evidence-based approach that we need to take towards solving this health care issue. It's not a political issue. So if anybody comes in with some political baggage around them, leave it aside. We're talking about fixing problems here.
Well, I'm sure if it were Herman sitting here, he would say, what you've just described is healthcare deformed. And to sort of coin a term as he's used it. But what we have all experienced, I think, is the impact of the insurance companies on the healthcare industry. And they've taken a lot of the flack for the need right now for this legislation. And how does the insurance lobby and the insurance industry play into this? Because we have all been, I think, on the back end of having to fight with insurance companies for the payment of legitimate medical services, and been, if modestly successful, that would be great. But we've all suffered under that. Right. What is the impact here for insurance? Go ahead.
Well, I think that we all are aware of, there are a lot of anecdotal cases of abuse. I think the bottom line is, first of all, we have to really get back to understanding what insurance companies are and what they do. And we can expand coverage. We can make sure that pre-existing conditions are not a reason for exclusion or ongoing medical problems. We can do all that, but understand that it will increase the cost. Now, are insurance companies efficient or cost effective? I don't think any of us buy that, certainly that have looked at this. Their profit margins, their sales costs, the soft kind of things are really not in line. But by and large, if you take that out of it, which is only a relatively small percentage, but a significant number, you've got the challenge of, if we expand our coverage, which we should, if we take away cap limits, if we get rid of pre-existing conditions, the cost will rise. And I think the other thing to recognize is that the private insurance companies today are, all of us, the people that have private insurance, are paying much more for their services than even the insured pool would demand, and that's because these other programs have shortfalls. If hospitals today, there virtually isn't a hospital in this country who can survive unless they have private good rates from private insurers that are going to cover these costs. So
okay, thank you. I don't know, Brian, did you want to expand on that at all? Or?
I'll just throw a couple things out there. And again, part of the issue that I come across and that I really see here is that one of the big things that it seems like the political establishment tries to do is demonize. There's multiple players that are involved in healthcare and this healthcare reform process. It's very easy to point fingers and demonize one industry over another industry, but demonization does not solve problems. And that's all that's really being done here. Just a couple points to make, and if you look at overhead costs, if we look at administrative costs for the private insurance industry, it's been about 12.7% over the past 40 years. That's numbers not from the insurance industry, that's actually numbers from the government. If you actually look at the overhead costs for administering Medicare, factoring in all the different components associated with Medicare, that's anywhere been estimated from about 25% up to as much as 52%. We have to be a little careful about saying, inefficiencies or efficiencies, whether comparing the private sector to the government, and just using Grandma's common sense. Does anybody here really truly believe the government can operate more efficiently than the private industry? I think we all live that every day in our lives. But that being said, I truly believe as far as moving down the pathway towards reform, I think we need to get every player in the game, everybody involved in the game, not pick out one particular player over another, because we can't have winners and losers in this situation here, because when we do that, the patients end up losing in the long run. So we need to get a board across the board buy-in to this change, whether it's insurance industry, pharmacy industry, physicians, patients, everybody needs to be involved into this process.